Welcome to the next episode of the LIT Show. The LIT Show is a program organized by Dr. Raut's Center for Reproductive Immunology, where we treat couples with repeated pregnancy losses, IVF failures, and unexplained infertility with the help of reproductive immunology, which involves lymphocyte immunization therapy and other immunomodulatory treatments. The purpose of this program is to have an interaction with eminent doctors, gynecologists, IVF specialists, and patients to share their experiences about reproductive immunology and how reproductive immunology has benefited them. Today we have a very special couple with us, Addaiya and Satendra.
Thank you, doctor, for having us here.
Welcome, Addaiya and Satendra.
Thank you, doctors, for having us here.
It is a great pleasure. We both also should thank you very much for sharing your experiences with the audience. Where do you stay?
We live in Chembur, Mumbai.
And what do you do, Satin?
Basically, I'm an operational manager in a travel firm. If you heard about MX, American Express, so
Yes.
we handle MICE events and conferences, etc., for the doctors, for the pharma companies, and all.
And I have my own travel company. I started in 2018, and also I write about travel offbeat destinations and all the adventure activities. And this is what I do. I am an owner of a small travel company.
Great. Actually, the reason why you are here is, yes, as Dr. Mugdha said, that you have been benefited by the lymphocyte immunization therapy or LIT. But we would like to know about your maybe journey in your life. Means maybe after marriage, how did you start to plan pregnancy and what challenges you faced in that? Can you throw light on that?
We got married in 2010, and since then we have been planning pregnancy right from the time we got married. We wanted to be young parents, so the experience was not that good when I got pregnant, and it was my 20-week scan, and doctor told me that there's no heartbeat of the baby. Like, getting pregnant wasn't a problem, but the pregnancy never went ahead of my second trimester.
Basically, it started from the year 2010
10.
when she experienced the first miscarriage.
Yeah. So that was, I asked even my doctor, previous gynecologist who was treating us, that what could be the reason. So he said it's just mere bad luck. So no reason behind it that why suddenly like a 20-week miscarriage happened. Then again after 6 months we tried again, but that ended up in a blighted ovum. Then we planned to go ahead with our careers. So again in 2017, again I got pregnant, and that was the most, I was diagnosed with IUGR. The growth of the baby was restricted, and the amniotic fluid levels went down. So we underwent amniocentesis and a number of tests. Even that ended in a miscarriage eventually in February 2017. Then we went to Dubai, and I was just going through the Google, and I was just writing someone who can treat recurrent miscarriages. So that suddenly ICPRM popped out, and I saw the names of you both, and I read all the testimonials.
But before that, I'm just interrupting.
Yeah.
What was the feeling? See, you were trying and you were not successful. So, you approached different doctors. So, what was your experience otherwise with doctors, and what was your feeling? What were you feeling about you're trying to do it? So, it does affect not only physically but mentally. So, can you say something? I think Satendra Ravi will be able to.
uh, it was affecting us financially as well, but more than financially, we were like emotionally disturbed because since we were trying from the last, let's say, 10 years, and it didn't happen. Uh, we were seeing kids around of our family members, like my elder brother, he got married after me. He got two kids. So that was affecting us emotionally. And we tried everything. I won't name it, the hospital or the doctors where we went, but again it was a failure after spending a lot of money, and again we ended up without having a baby. But since Addaiya told me about Dr. Raut Center, I said we have done so many things. Let's give a try to this also.
Absolutely
And
right, because I think Satendra, that's what we have experienced or we have seen. We get patients who say they have undergone 3, 4, 5, 10, 15 miscarriages, and the experience is similar what you shared just now. See, because we feel whether a couple has one miscarriage or 10 miscarriages, the sorrow or the pain is same, whether it's the first, second, or third. So you can imagine, you can imagine what will be the condition of the couple. So we have been seeing this, and most of the times what these couples are told is that there is no cause, it is unexplained, and you keep on trying, next time it will be fine. So, and this next time never comes, and so the cycle goes on, and that's where I think the as Satendra said, the psychological element or mental element comes in picture, and it is very disturbing. So I think
and
at that
literally,
stage
Mr. Rao, we even thought to give up.
Yeah, we literally gave up. Like we lost hope. I was getting unproductive at everything. It was making me feel a less of a woman. That there is no reason why it is happening. Will I be, able to have a child unless doctors don't find the cause why the
right.
children are dying, why it is happening, why am I miscarrying? There is no particular reason. All the tests were coming up normal. We even did genetic karyotyping, even that came up. That was even fine. Doctor said you are healthy. Then why? That was the question every time that we and I have been seeing like my friends who got married after me. They were having two children, three children. Even people were completing their families. Then even people, when we used to visit social, gatherings, weddings, so everyone used to come up and ask कि क्या हो गया. They used to give me some IVF center का addresses, or someone even suggested a surrogacy. That is not your cup of tea. You better find another woman. Let that woman handle the child.
Oh, no, absolutely right. See, I will share one story, Addaiya. There was one couple who had 15 miscarriages, 14 miscarriages, and actually they had come for sterilization operation. So when we asked them कि why sterilization, how many children you have, they said we don't have a child. But now I don't want to go through this miscarriage once more. So she said that is enough. Now we will undergo sterilization so that there is no chance of pregnancy, and we don't have to face miscarriage. So to that level problem can occur. So I think that's why we felt when we see these couples, we really felt we have to do something, and with God's grace we could start something which was useful to you. I think you were mentioning about what you saw, or someone recommended you, or I think your Google search, I think.
I was, persistently searching about a doctor in Mumbai who can treat recurrent miscarriages. So, but in the search, I got, like they hunt the keywords Google. So your institute's name popped out, your clinic's name popped out, and then I told him, see this, we have to go there. Once we are in India, we have to go there, and so that is how we came back for his brother's wedding. And then I fixed an appointment with Dr. Mugdha, and that is how it went.
So, what was your experience? You came here for the first time, and when you met Dr. Mugdha, do you remember what was the interaction, or what did you feel? Did you feel, oh no, this is the place? Things may happen right, or
Yes, it was a lot of, I have been to the previous doctors, but when I met Dr. Mugdha, and even you were there for the first counseling, So after that, when we were discussing, we were out of the clinic, and I said, see, I have some positive feeling कि यहाँ कुछ होगा. So he was like, okay, he was going to Dubai, and he said, yeah, you go ahead with the treatment. Then let's hope for the best. What happens? So we were like, yeah, I got that 100% feeling. Yes, this is going to work.
And I still remember Dr. Mugdha
And even
listened
you
us
said, yeah, she
very
was patiently
calmly.
listening to us. She told me everything, how it happened. She explained me all the
The entire
possibilities,
procedure.
yeah, and the procedure. And then even you said, ki, see, by next year you will have a child. So I still remember it is vividly in front of me now.
Okay.
After LIT, you underwent LIT. Then
So how was that experience
of the therapy itself?
So you underwent lymphocyte immunization therapy, as LIT we say. So
Yeah.
did you have otherwise any idea about what it was and what it would
No,
be?
this was something new, and it was, my sister was the donor, so we were very excited that we are, and even she was excited that she is contributing to something big. So we came for the treatment, and that day she donated the blood, and the process was good. We were, then, yeah, then doctor, she injected me the injection with the lymphocytes. Nothing, it was just very a smooth process. I went home and I was just waiting. Doctor told me that 6 weeks you cannot plan pregnancy, and he was in Dubai, and I was just patiently waiting that when the 6 weeks are going to pass.
So how was the whole process like? How many hours it took to?
It took nearly 3 to 4 hours.
So after the LIT, as you said, 4 to 6 weeks, we were going to wait for you to plan the pregnancy.
Yeah.
So I still remember the time when you told me, "I am now going to Dubai, and we are planning the pregnancy. So what should we do?" So I think I had given you a big list of medicines which you take after you conceive.
Yes.
So then I think it was a natural pregnancy for you. You conceived spontaneously. Yeah.
Yeah, spontaneously.
Yeah.
Yeah, I went to Dubai on 28th of February. I reached, and 17th Feb, like I missed my periods, but still I waited for a week, and then it was a surprise. I was like, yeah, it came out positive, and then I messaged you as well that, doctor, I'm already 5 weeks. Today I had my first scan. I messaged you. So
Yeah.
you gave me the list of medicines, and you even mentioned that have egg bites, 4 egg bites. That is still everything. That whole the
And doctor, she even coordinated with the doctor in Dubai also.
Yeah, even my
Yeah.
doctor in Dubai, even I think they were in touch with you through emails.
Yes.
Dr.
So
Priyanka.
before you go ahead, so at that stage, at 5 weeks, what were your feelings? You were still worried? Okay, what you have experienced, is it likely to happen, or you were sure it's not going to happen? Just
Uh, to be very frank, doctor, like I was still 50-50. Okay, I didn't told to anyone, okay, that she's pregnant until unless I saw that period through the 5 months.
okay.
When we passed that 5 months, then I was dead sure. Okay, now nothing will going to happen. This time, like we would be mom and dad. So then afterwards, we told everyone.
So during pregnancy, I think as Dr. Mugdha mentioned, you took a lot of medicines, or was it a difficult thing to take injections, or
Yes, it was. Obviously, taking injections by yourself, it is little scary. But yeah, but that was okay with me. I was on extra medicines, and even as I was diabetic, so I had to be an extra careful with it. But things were in well controlled. I was in touch with Dr. Mugdha. I was in touch with my doctor who was treating me there. They both were in touch with each other. So things were pretty smooth. The pregnancy was good. Only, yeah, the medicine and the Clexane injection which I was taking, that was a little difficult part, of course. Like,
but your doctor in Dubai, was she little? What was her reaction about the LIT, or did she discuss with you or ask you about it?
she asked me in detail how was the treatment, how did you go. She asked me about the website link. She even asked doctor's phone number. So I furnished her with everything. So the next day she called me up. She used to call me up every morning to check on me. So that time she said that I've been through the website, I've seen everything, how the treatment works, and also she said okay. Even those medicines which were prescribed by doctor, she started with the same treatment.
So, during the pregnancy, did you face any challenges?
Nothing as such. I was doing my own work, yeah, except for this first 3 months, this evening sickness. I will say evening sickness because it used to peak after 4 in the evening. So that was the funny and difficult part. Otherwise, the second trimester was a cakewalk. Third trimester was little, I have to go. I was in India. We returned to India, and third trimester even I was tested COVID. So it was a little roller coaster, but things went very good. Like I didn't face any problem.
So there was no IUG, the baby was, the growth was fine, and what you experienced in the previous pregnancy, nothing of that sort came up. Not, of course, the serious problem, but even the growth of
Nothing,
the baby
nothing.
was fine. And hello.
Everything was fine.
Everything,
Everything was
all,
fine. We were really happy
very
to see
happy.
the growth every month. Like every month we used to.
Doctor,
I was physically I used to leave my office and I used to go there
for
to see the
my
progress.
for my antenatal checkups, he used to be there. Then 4th of July was my anomaly scan, and then that scan, previous pregnancies was the most scariest things. All the bad news as I used to get was in that scan. So when that scan came out very perfect, like doctor said the baby is fine and everything is good, your baby is progressing very good. Then we were like 100% sure that yeah, this pregnancy is going to, we'll be reaching third trimester.
So actually, what you're saying is right. I remember one patient who had 2 or 3 times second trimester miscarriages, around 18, 19 weeks, twice, I think. But every time 18 weeks she used to complete, heartbeats used to disappear. So when they took the treatment, LIT, and when she was pregnant, in that period, after 16 weeks, they were so scared, so worried. Every day they used to almost call. Every week they used to come and just do the sonography just for heartbeats. This is we just, even if you just check heartbeats, it is fine. So they used to travel all the way from South Bombay to come and just to check heartbeats, and they used to be relieved. So till they completed that 24 weeks or 25, as you said, after that danger period was gone, only then they were little relaxed, but that was natural. And we were happy that they also overcame their problem and they had a nice baby son. So, what was the feeling now? You were approaching 9 months, and so at that stage, what was your feeling? Because just to know more about it.
I started with the shopping. I was like 9 months, and and I still miss being pregnant, to be honest. And that was lovely. Second trimester, I could see the baby move. I made videos. I started shopping. I was highly elated. And this one was in Dubai, so he didn't get to, I still regret that he didn't get to, feel the pregnancy, how things are. But I still miss that, and I don't know. I miss being pregnant. I don't know, that might sound weird to you, but and I started shopping, and I was still like waiting when I'll enter the month of November.
So actually, because we only see you in the clinic, the interaction is there. What happens in between the two visits? We are always curious to know, especially when you have overcome such a big problem. So that is definitely must be a great feeling. And
Yes,
I think then the final day came, I think.
Yeah, and just one thing is, I think today your son completes 10 months.
Yes.
Right? Yeah. So today is a very nice day for us to do the LIT show. And yeah, then when this was there, when you reached your 9th month, and like what were the challenges at that time, and how did we go about it? Like, could you share from your experience? Like I can medically say I know what was happening there, and
9 months. That is something, I don't have words. So yeah, I will say like I was a cow, lazy cow. I was just eating and sleeping. I was taking my bump pictures every week. So I have made the printouts, I've made the journal. So I used to stick how I'm looking at 36 weeks, how I used to look at 35 weeks. So that is how I was going through. And I was planning. I was shopping, and we were very excited, whatever it would be, like it's a girl or a boy. Finally I'll be having it. So started picturizing how would the baby look. A typical motherly and girly stuff, That was something I started shopping for the. I told doctor also on the last visit that my fancy handbags have been replaced with a diaper bag, and I have three now. I am still not satisfied with the diaper bag I have. I needed spacious, I need something. So that was all, planning, everything planning, seeing videos, reading internet things, and all planning started, and that excitement started growing up. When I'm entering the month of November, when is 20 November coming up, that was my due date.
Really.
Yeah.
and I think I remember that we had to operate earlier because you went for the sonography, and Satendra also was not in India, I think, at that time.
He was
So,
coming on 30th.
ah,
So yeah, I got a call that good day. I was, we came from Dr. Anuradha, my sonographer, and it was really late that day. It took us around 3 hours, and what she does is when she moves the ultrasound machine, and she used to tell me, "Yeah, baby is fine." But that day she didn't tell me anything, and I was keeping on asking, "What is it going on?" She didn't tell me anything. And then I think at 3:30 or 4 o'clock, Dr. Mugdha called up. You have to come to the clinic. And that day, literally, I was shopping for a blanket and all that thing, and I didn't knew that by evening, we all our relations would change. My parents would turn into grandparents. I would have a baby in my hand. He'll be a father. So that's one good thing. Like the thing I was waiting for patiently. That time even God was with me. He said like, you have a baby in your hands little early.
I was a bit scared when my mother-in-law told me that she would be getting operated today. I was damn scared. I immediately rescheduled my tickets on the same day. By the time like I was doing my packing and everything, I got a video call from my mother-in-law stating that you are a proud parents now.
So, what was the feeling, Satendra, and I think Addaiya, both of you? What was the feeling when you had the baby in your hand, or you first saw the video call, or whatever, when Satendra came here and held the baby?
Uh, these are feelings, doctor, which you cannot describe in words.
In words, yeah.
Literally, the first time I saw him, I started to cry, and still, if I recollect that moment, I don't know what to say, but it was really beautiful moment for me. I was waiting for this from last 10 years, and finally it wasn't. And I told Dr. Mugdha also. I thank her very much. Because of her, we saw this day. Rather, because of both of you guys, we saw this day today. Or else, I had literally lost the hope that we would be parents.
But I think God is great, and the things went in the right direction. And I think that's
because I think your sonologist called me up immediately, and she said the blood flow is reducing, operate immediately, So that's how I remember I gave you a call, come to the clinic. We didn't want to scare you or, this, and we said, you come to the clinic, we need to operate on you immediately.
So how is your son now?
Once again, I'll get him.
He's great. He is like, he's keeping us on our feet. My parents are enjoying every moment with him. Every day he's sleeping. We got lucky. He's sleeping. So every milestone, everything we have, it was really a different whole lot of a new experience for us. Becoming parents was, I mean, it's lovely. Whenever we see him smiling, all that I went through, it's like it was worth.
That's really nice.
The amount of injections she has taken.
Oh God, my mom used to literally cry, when I used to take those injections, and sometimes it used to go in the wrong direction, and I used to start bleeding. And she used to literally cry when this when are you stopping this? It was like I have to take it till 35 weeks, and I still have one of my Novo Rapid insulin, my Lantus insulin, and that Lexane, like keepsake. I still have that in the fridge.
So then, in the end, do you think at the end of the delivery, now do you think it? What do you think about LIT, lymphocyte immunization therapy? Looking back, was that the only difference between before treatment you took before and after? What would you like to say about LIT?
I would say yes, it has made a difference because as I told you, doctor, like we tried everything. Only thing we were supposed to try was IVF, right? Or
Surrogacy and
surrogacy.
IVF, that was only left. So see, this is something new, and this is not like IVF. The IVF procedure is very tedious. This was easy. Even though it took little time, but it's worth the thing. And I would like, if I have to, if I speak about it to everyone, that what treatment I have undergone. And I always say, if you're facing such problem, there are relatives and friends who are not able to conceive. Some of them have undergone IVF, but they have IVF failures. So I spoke to them. You have to, this is something, a new treatment, and a very easy process. So everyone who has their treatments are question mark, like unexplained stuff. They should go give a shot.
And financially also, the cost is comparatively cheaper
Yeah,
than
it's
IVF
not,
or
yeah,
surrogacy.
comparatively as compared to IVF, this is affordable and it works. Now I say it works, 100% works. I confidently tell everyone, give a try. Whoever is facing such a problem, you should definitely visit Dr. Mugdha and Dr. Mohan. And the counseling session, I told them about that. I had a counseling before. We had tests, and according to tests, they'll suggest you the treatments. So anyone who has problem, they should research and give a shot to such new treatments. Even that encourages the doctor to go and find something new.
You,
I have told everyone in my friend circle in Dubai or in Middle East who are facing this issues. I've told them rather like rather you have tried so many things, try this thing also because it has worked for us and for many others. Like who I know, like the people who have came to your clinic when I was there, I spoke to them, and there were such stories, doctor. To be very frank, so I recommend everyone. I tell everybody uh, to have this treatment once.
Even like your podcast, the Marathi and the Hindi, the latest we got was Hindi podcast link. Even that we shared, so that like they are listening from the doctors itself, how it is. Even though I have told them all the podcasts, whatever link he used to send me, LIT show as well. So I say, yeah, we share the link. We have a group of friends, so we share the link. We discuss, and I have told everyone, like, see, it's no harm in trying something new, and this is something which works for us, will work for everyone. So better, if you're facing problem, you should give a try, definitely.
exactly what you mentioned. One thing you mentioned about surrogacy. So we see a lot of patients like this referred to us. They come to us. They have multiple miscarriages and they've been advised to undergo surrogacy. And they don't want to, or some of them can't afford. So and they have been referred to our center. Some search like you, and they have come to our center, and many of them have been benefited. So that is really one thing that has given us a lot of, you can say, a nice feeling that someone who could have, a couple could have their own child, and they don't have they have with themselves and not to undergo surrogacy. So that is a really good thing. What we feel it can help couples as an alternative to, I won't say alternate. There will be couples who will require surrogacy 100%, but those who can have their own child, they have been benefited with this. So it's really nice to hear from you that about your success story. And but tell me one thing. You do you find any side effects? Did you find any side effects or any of the therapy immediately or later on? Now the 10-year past your delivery and your 10-month child, in the child or in yourself.
Nothing. Only like when I was injected, I had a itching. That is was I think for some time. Apart from that, nothing happened. Nothing throughout pregnancy. Nothing postpartum. Nothing.
Great. I think because there are a lot of studies also which also say the same thing, and it's the safety of the procedure is very high, and which we have seen in our patients also. Right.
So, what would be your message to couples with repeated pregnancy loss or IVF failures? I mean,
what would you like to tell them? So, if there are doctors listening here, and there are other patients who are listening here, so what would you like to tell them?
Number one is never to lose hope. If you're going with any treatment, even if it is LIT or any other treatment, you have to be positive throughout that I am going to get a good outcome. Now that there are, like as I've said, there are my friends, colleagues, and my mother's friend of friend, their children, daughter-in-laws. They everybody, they asked me, like, she had a problem and she had a child through treatment. So how it went, how it was it, is she facing anything? I really have a message that please, if someone is facing such a problem, you have unexplained infertility, IVF losses, they should definitely look out for other problems as well, as Dr. Mugdha said, that alloimmune factor. So yes, so they should definitely visit Dr. Mohan, Raut and Dr. Mugdha for counseling, and LIT works, and should also try give a shot. Like we I know my struggle. I have done every possible thing. I visited every possible doctors, spiritually, scientifically, everything. And one thing is, always believe in science.
And that's great. I think it was really nice to hear from you, your experience. I know you were coming regularly for treatment, but to hear the other side of the story, it was really interesting. And I think the message that you're given to, I think, patients is also really will increase their belief and hope, I think.
So, we would really again.
Thank you for calling us on and having this session. We are really thankful to you and to the clinic and everyone at your clinic who supported us, given the timely recommendations, the feedback.
Yeah, that was there when 28, like when I was, that was a timely, spontaneous, and a very lovely decision that I had to come. I have to get admitted, and even like I was told about very bad things about having a C-section. Like ऐसा होता है, वैसा होता है, later you'll suffer. That is very painful. But when I was literally going inside, I was smiling. I entered the operation theater with casually, just like I am entering some cafe or anything, like casually. Yeah, and then we were talking. I think we were talking also, even Dr. Vatsal and Dr. Bindu. Yeah, and even about the spinal block, which everyone 99% of the women who are C-section will scare you about the spinal block. That you will have pain, and while giving me, you will scream on top of your lungs. That was really nothing like that.
So, Doctor, once again, thank you so much for giving us
a wonderful
gift or
pumpkin.
whatever.
I know.
So, listening to your story, I think you are now already preparing for the second one, looks like.
Definitely, we have to do
Yes,
it.
you must.
Now it's a trend, doctor, going on, 2 under 2. But I don't think so that's possible in our case. But yeah, we'll
But
Wonder
definitely.
two.
we give it a try.
Yeah, there's a trend everywhere. The trend is happening that 2 under 2. So I was even telling him. So he was like, "No, you're not that patient. You won't be able to handle a pregnancy with a toddler. So have
I said like
patience."
So you
just
are
2 or 3 years.
And on a lighter note, like I wanted to, we both wanted to tell you for a long time. My donor was my sister. If I don't know how, it's just a lighter note. Uh, I don't know if that happens really, but the baby has all of my sister's feature. So you can research. Yeah, so both of them are dads. So if the child is looking like dad, or the child is, showing features of a dad, so that's not that, noticeable. But here the donor wasn't that, but his Masi. So he's showing all my sister's feature, everything in left hand, everything what she used to do. So yeah, you can even, research if,
The donors.
the donor's features come into the child.
no, it's not exactly like that. Actually,
And just a lighter
Yeah,
note.
yeah. It's on a lighter note. Yeah.
because the
I wanted
principle.
to speak on that, for science.
Yeah. Now, good observation. Because, but the principle, the scientific principle is any lymphocytes other than the patient will produce the similar effect. So whether if husband can't give, any other donor person can give, provided all his infection profile and everything is normal, and it will produce the similar effect. So we have other couples where brother-in-law and father-in-law and friend and colleagues, they have donated lymphocytes, and those couples have also done well, and they have overcome their problem of miscarriages or IVF failure.
You can ask them. If someone with father-in-law, you can ask them if the baby is exhibiting some father-in-law's feature. Yeah, if like the first sign was his blood group is B positive. So my sister is also B positive. So that was there. So yeah, and even my mother, he even looks like somewhat like her. So my mother was telling me, you can tell Dr. Mugdha that the donor's features come in the child, so they can even some medical information for doctors.
Okay. So,
So then we'll end at this.
so thank you very much, and it was nice interacting with you. And I think we will meet again. Maybe your son
So
maybe a
maybe
bit
next
more
2 or 3 years.
Yeah.
with your second son or daughter. So we'll meet again then. Okay. Thank you very
Thank
much.
Thank you so
Thank you
much.
so much, doctor.
Yeah. Thanks for the time. Really appreciate.
It's our pleasure, doctor.
Pleasure, doctor. We really enjoyed
And anything for you guys, anytime you tell us.
anything for Dr.
We owe
Mugdha
you.
and anything for Dr. Mohan. We owe you a lot.
Thank you very
so
much.
much.
Thank you so
Thank you.
much.